Foreigners seeking treatment for COVID-19 in Singapore will now have to pay for it. The policy came into force on Saturday. However, the government will continue to pay for testing for the virus in the interests of public health. And this comes after 10 new infections were reported today. Cheryl Go with this report.
As of Saturday, foreigners on short-term visit passes will need to bear the entire costs of their treatment for COVID-19 in Singapore. The Health Ministry says it will continue to waive the testing fees. This is part of public health measures to identify and initiate contact tracing for confirmed cases who may have been infectious while in Singapore.
The number of COVID-19 infections are rising globally, and we similarly expect a rise in the number of confirmed cases in Singapore. We will thus need to prioritize the resources at our public hospitals. The government will continue to pay for the COVID-19 testing fees and hospital bills in full for Singapore residents and long-term pass holders who are admitted to public hospitals for COVID-19.
Among the first imported cases to be affected by this new policy is case 147, a 64-year-old Indonesian man who arrived in Singapore at Seletar Airport on 7th March. He had already reported symptoms on 3rd March while he was still in Indonesia. On arrival in Singapore, he underwent a swab test at the checkpoint, the first case to be confirmed by this precautionary measure. He's currently warded at the National Centre for Infectious Diseases and will have to bear the full cost of his hospital stay and treatment. Another case to note is case 151, reported as a new case on 9th March. The 51-year-old man is linked to the Life Church and Missions Singapore cluster. He was confirmed to have had the infection by serological test results on Sunday, which confirms a past infection. We understand he had mild symptoms and recovered after seeking treatment at a GP clinic and Yishun Polyclinic. He was warded at NCID for testing of the virus after he had recovered and has since been discharged.